and Brad, the two most famous physical therapists on the internet.
Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course.
That's
Bob.
all that matters is our opinion. Today,
Exactly.
Brad, we're going to talk about the 10 habits to get rid of back pain forever. So these are things you want to start incorporating into your life if you got back pain, to slowly reduce the amount of frequency and duration of the back pain you're having. So,
and there's one thing I want to put in here to an analogy. I think that makes a lot of sense. I say this to my patients sometimes, is if you think about your back, you need to manage it, have good habits. It's just like your teeth.
right.
If you don't brush your teeth, you don't floss your teeth, they're going to go away, they're going to rot, you're going to have big problems. Everybody understands that clearly.
Yeah.
It's the exact same thing with your back.
I specifically relate to that because I just came from the dentist yesterday. So, okay, Brad, let's start off with the first one. The first habit you want to get into, especially for the average back, this wouldn't be in your case if you have spondylolisthesis, but you want to avoid the C-curve. Now, normally you have, the back has the curve in, curve out, curve in.
Right, the S-curve.
Yeah. The trouble that you'll get into is if you put your back into what we call the C-curve. So Brad, here, I'll put it like you.
Okay,
All
so
right.
if I'm sitting with my good S-curve, I'm like this. If I slouch like this, or if I'm at a computer and I'm
leaning like
this,
that.
or looking at my phone like this, I'm going into this
C-curve.
C-curve. This might be a little exaggerated, but that's okay. It's good to
Just so they can see.
get a good visual.
See the curve. But the thing is about this, Brad, is the way we're structured now today in society, your back's in this position quite often now, especially with sitting. So, and lifting. I mean, I see people that lift like that. I see people that stand like that. I see that people, shovel that way. So all these things.
I see people in the weight room who should know better, and they're lifting. It's like, oh man, you put a lot of weight on, and it's going to accelerate the problem.
Even worse. So, okay, the second thing, Brad, is you need to get the back moving in some way. You need to have some exercise where you're actually getting some movement in the joints.
And that also promotes good posture, I think.
Right, right. So the one that we really like, well, there's a couple of them that we really like. One, can we start off with one of them, Brad, here? I'll go ahead
And Bob, before we start out, there's a lot of people who haven't seen our videos before.
New to our channel.
Right, and if you want to get more information like this to help your body long-term between your children, yourselves, and your parents, subscribe on that button right over here, please.
Yeah, and we upload a video every day, so and we cover a wide range of topics.
You better believe it. So let's get to the back problem.
Right. The first one, this is a good one for a lot of people, especially with arthritis or if just general back pain. It's good just to start doing some rotations like this. Now, it looks like I'm just moving the hips, Brad, but actually the back is turning too, and we're getting all those facet joints to move, and everything's, all those articulating joints are moving.
Bob, your tie, we got to fix your tie. What are people going to think? Okay, carry on.
So now if you go this direction and it hurts, well then just go the other direction. Find the movement that you can do that's pain-free.
Right, exactly.
And over time, try to increase the movement.
I was just talking to someone about back pain, and they talked about their stretches, and they said, well, no pain, no gain, right? And that's the farthest from the truth when it comes to back pain. You need to find exercises that make it feel better, not worse.
You can bump up against the pain, but you never go ahead and go into the pain or make the pain worse.
Yeah, you don't want to irritate it.
Right. The one that's even better than this, again, this is for the average back. This isn't for someone who's got spondylolisthesis or spinal stenosis. But you're going to want to definitely include this in your life, is you're going to want to do some back extensions. So what you do is you start off in what we call the prone position here on your stomach. Hope you can still hear me with my mic. And you're going to put your hands right below the shoulders, and you're going to keep the pelvis on the bed, and you're going to press up like this.
So right here, this stays down. Why don't you show them the incorrect way that a lot of people have? And that's not what you want to do. You want to keep this down. As a matter of fact, in the clinic, sometimes I'll actually put my hand on here to help patients get a real good
get a
feel
sense
for
of what they're supposed to be doing. And again, you go as far as you can without increased pain. So let's say I go this far, it's starting to hurt. Just work in this range then. And eventually, hopefully you can get way up here like this. Now these things, Brad, again, you don't do these, but I do these at least twice a day. I mean, I just, it's a part of my life.
Right.
And actually, even after you, let's say you do some lifting or something like that, you can stand up and put your hands on your back and bend back like this.
Right.
So,
Now, so there's two conditions specifically that we know you don't want to do that. And one is with spondylolisthesis and
spinal stenosis.
spinal stenosis. And I know with spondylolisthesis, there is an estimated 7 to 10% of the population that have that. You don't always know you have it, but you may. So we're talking probably, 70% of the people could do this.
Right.
And you'll know because it will feel good typically if you're doing the right
I also want you to stretch your back, and that's kind of the same way. I mean, I'm stretching my back,
Right.
but there's other stretches. We have a whole video on how to stretch your back, back, mid-back. I can link up to that right here, Brad.
Sure, okay.
But let me show one stretch. Is this the downward dog, or what do they call this? Is that
I just had a comment by someone in yoga, and she corrected me on the names of these, and she even gave us 2 links, and we should both watch it. And I didn't look at it this morning yet.
Oh, so this is probably isn't the downward dog.
Yeah, we're going to get in trouble here, but
Okay.
she's going to watch us.
Legs apart.
We apologize
Okay.
for the.
You're going to put your arms way out here, and you just kind of put your butt onto your heels, and this is just a good long stretch you can do.
All right.
So
If you've got a herniated disc, you're not going to want to do this one.
if it makes it worse.
Yeah, be cautious with it.
Right, right. All right, number 4, you're going to want to strengthen your back, Brad.
Right.
I mean, you want to do some things that are going to, help keep it nice and stable. Strengthen your core. We've done a
Right.
couple videos on lumbar stabilization exercises.
There's a lot of different ways to do core strengthening.
Yeah. Let me show just one.
Sure, you
Okay.
bet.
This is probably a little more advanced, Brad. You're going to get up on what we call the quadruped position, or all fours, and you can just start off by, bringing your arm up like this.
Right.
And then bringing up a leg. Am I going to kick anything?
Go, it doesn't matter, Bob. There you go.
All right, and this is, the back is working. Now this is a little more advanced.
Right.
A lot of times we start down on a pillow, and we start like this.
So we're working the muscles right in through here, stabilizing them.
So I'm going the opposite arm, opposite leg, opposite arm, opposite leg, and then I can go ahead and kick the skeleton and go the
Right,
other
yep.
opposite arm, opposite leg. So, very easy to incorporate in your life, and you're going to start to feel that core strengthen, and you're just going to feel a lot more confident when you have to do lifting and such.
Right.
So, all right, number 5, you want to support your back, which means when you're in the car or when you're in your office chair, especially when you're in your car, Brad,
Right.
don't you agree?
I agree.
Everybody should have some type of back support in their car.
A lumbar support.
Can you grab the chair, Brad?
If you've got a car that has a built-in lumbar support, they have some of the newer cars in the last 10 years really have some nice lumbar supports.
But if they don't,
And if they don't, you got options. And this is what I start when my patients, instead of having them go buy one for $10, $15, $20, I say take a towel roll like this, tape it up, and you're going to put it right about at the belt line, and you're going to put it back
and
there.
he slides his butt all the way back.
Yep. And you're going to know if it's right because it is immediately going to feel like good support. If you put it back there and it hurts and it's uncomfortable, it is not the right thing. But typically, you're going to feel good. And the size of the towel, the diameter is what you really have to determine. Because if you're a larger person or if you got a softer seat, you're probably going to use a larger diameter. If you're a small, petite person or you got a really firm seat, it's going to be a little bit smaller.
Yeah, Brad and I just use this real thin piece of foam. It seems to work well for us.
I keep this in my car
Yeah.
all the time. Some days I don't use it. Some days it feels good. It depends on how my back is feeling that day.
So now let's say you're on a couch, Brad, and a couch you're going to sink in, and you're really going to need some support. That's where you actually need to take like a throw pillow, and put it in there because, you need so much. This wouldn't even do it,
Right.
and neither would this. So
You get in that furniture is made like big marshmallows and
Right.
just sink right into it. You really need to get a decent sized pillow
Exactly.
to support that back.
Number 6, I want you to control your environment, which means, number 1, like if there's commonly used items, Brad, that you use every day, don't put them way down below where you have to bend to get them.
Right.
You want to keep commonly used items between your shoulder and like your waist.
Right,
Somewhere
exactly.
right here where you're going to use, your wife may scream or your husband may scream at you for the kitchen, but that's what I do. I put all the things that I use on a regular basis right up in this area here.
Or the heavier things, even if you don't get them as much, but you do get them and they're heavy, don't put them way down on the bottom of the shelf because then you got to bend way over Try and keep them at the waist level where you're strong and you keep the stress off the back. That is be a good example of that ergonomic buzzword.
Right, and the other thing is that, learn to say no. I mean, you're not the young buck anymore. Don't be trying to lift a couch when your kids ask you to help. So.
Or a piano. If someone wants to help you move the piano, say no.
I want you to avoid stacking events. That means I don't want you to put 3 things in a row that are hard on your back, which a lot of times people don't realize. I had a patient that one time was cutting lawn, Brad.
On a rider?
Riding lawnmower, which she thinks is not a problem, but you're bent and your shock absorber, which puts really hard stresses on your back.
Sure.
Then he went to driving a car for 2 hours.
And he probably didn't have his lumbar support.
And then at the end, he went to the back of the trunk and he wanted to pull something out of the trunk. And if you know trunks, you can't bend your knees. You have to reach over like this. And his back went out, and he couldn't figure out why. It's like, well, you stacked 3 bad events in a row.
Right,
and your back didn't have any recovery time. Bed positioning, Brad, you were going to show just a quick bed positioning tip.
This is a very simple one. You don't have to have anything except for using your mind and listen to your body. This is what I do on a regular basis. If I lay down on my back and my back feels a little uncomfortable, I take my hips and I shift them either to the right or to the left, and I know which way because I shift just an inch or 2, and the pain may go from a 3 down to a 1 or a 0. And then I just find it and I stay right there, and then I try to sleep like that. And what usually happens is I wake up on my side and then my back is bothering me, so that I get myself back in my position. I do my shift, get the pain down to a minimum or 0, and then I fall asleep like that, and I try to train myself to sleep on my back.
I'll link up right here too, Brad, our whole video on positioning that we have with pillows and stuff like that.
We've got some more details.
Number 9, you want to make sure you're doing some exercise. Walking, something aerobic really helps your back,
Sure.
especially walking.
Yeah.
Really a good thing for you to do. And number 10, you want to make sure you are lifting right, Brad. When you're lifting right, someone should be able to take a stick.
Club you with it, Bob?
Yeah, and if I'm lifting right,
Here we
this
go.
should all be lined up, shouldn't it, Brad?
Gotta go this way a little bit, Bob. There you go.
This should all be lined up.
Right.
That's like this, where everything's all lined up, you're going to do really well.